Are we ready? I'm not used to being able to kick it off. Well, welcome everyone. Thank you for joining us today. It's a special welcome today to Senator Tina Smith. Thank you for joining us. And of course, Greta and her mom, Sarah, thanks for driving into the Twin Cities and taking some time, right? You ready to represent your peeps? Yes, all right. So with that, we gather today on an utmost important and very urgent matter called Medicaid. This essential program serves about 1.2 million Minnesotans, of which about 600,000 are children. Medicaid is a lifeline for children with defined medical needs and those living with disabilities. As our children mature, Medicaid remains critical, ensuring continuity of care for young adults and adults with disabilities who rely on its support. Let me emphasize this, that Medicaid is the lifeline for children and their families, providing critical support for their health care needs. It also serves as an indispensable resource for individuals with disabilities stemming from complex medical conditions of no is what Medicaid program is built for, and it does. Medicaid, in partnership with other agencies and programs, is foundational to our kids' health and well-being throughout their life. At Gillette Children's, about 70% of those we serve qualify for Medicaid, either due to their income or to their disability. Cuts to Medicaid will be catastrophic, not only to our patients and their families and their communities, but also to Gillette as an institution. Medicaid has been instrumental in enabling Gillette Children's to thrive as an independent specialty healthcare, and as a nonprofit institution without an endowment, we remain dedicated to serving young people living with complex medical needs and disabilities. Medicaid provides critical funding that supports our ability to deliver appropriate specialized care directed by physicians. This includes access to advanced treatments, therapies, and medical technologies that are often not available elsewhere. I extend my personal heartfelt thanks for Greta, Sarah, her whole family. Thank you for taking the time, and of course for Senator Smith. When you see us come together, you know this is an important topic. Now I'd like to turn it over to our Chief Medical Officer, Dr. Micah Neerman, for his comments.
Thank you very much, Barbara. My name is Micah Neerman. I'm the Chief Medical Officer here at Gillette Children's. I've been taking care of children with complex medical conditions for my entire career. It's nearly spanning 20 years. When discussions turn to Medicaid cuts, some may see line items in a budget, but in these numbers, there are people and there are children. There are families navigating uncertainty and anxiety. Children with disabilities in particular depend on regular therapies, specialized equipment, and continuity of care. Cuts to Medicare don't just strain a system, they put lives at risk. If these cuts move forward, it will mean less access to care. It means a greater financial burden for families. It will mean poorer health outcomes. I was talking with a family last week in Mankato, and the patient's father emphasized that Medicaid allows him to assure that his daughter has the in-home care that she requires, and that he's able to work and support their family. And he said something that struck me. He said, you know, I don't want to be her nurse, I don't want to be her doctor, I just want to be her dad. And that's all that parents truly want. They want to be able to be the best parents that they can be. For kids with disabilities, Medicaid helps parents realize this. As a physician, my first ethical obligation is to do no harm. Medicaid cuts will cause harm, deep and irreversible harm, not in an abstract way, but in direct and tangible ways for real people in our communities. So to shed a bit more light on how Medicaid cuts will impact Gillette families, I want to introduce both Greta and Sarah Lindbow. Thank you both very much.
Hi, thanks for having us.
Well, good morning, everyone, and thank you so much for being here. And I want to particularly thank Barbara and Dr. Neerman, and especially Sarah and Greta for being here. and talking about how important Medicaid is to providing health care to people all over Minnesota. You know, over the last several weeks, I have gone all over Minnesota talking about how important Medicaid is, medical assistance in Minnesota is as a source of health insurance for so many people. And I have really good news to share, which is that around this state, people support Medicaid as a vital way to improve access to health care all over the state. And one of the things that we have been doing in these conversations, Barbara, is helping people to understand who is served by Medicaid and how deep it runs. Medicaid runs throughout our community as a way of making sure that people do have access to health insurance. And so to be here at Gillette, which is such an extraordinary institution, an organization I was reading last night that has been here since the turn of the last century. The first, as I understand it, let me get this right, the first public hospital dedicated to pediatric care in the nation. And to understand today how important Medicaid health insurance is for the functioning of this institution is really is a big part of it. But to have Sarah and Greta here to explain a little bit about what it means to you and to your families is really like the highlight of my day and my week to have you here. And I want to just say, we'll start a conversation here, but I want to say that it's not that easy to come into a room like this with people that you don't know and cameras and talk about your personal life and your personal health. Health is fundamentally not a political issue. It is a personal issue. And so I'm just really grateful for both of you being willing to be here and tell your story.
You. We tell Greta it's our job sometimes to explain our life to people who maybe don't realize or aren't as familiar with it, so that everybody knows what we value and what's important to us. So sometimes it's our job to be educators. So we're happy to be here today to do that.
That's a great way of putting it. So let me ask you, just could you tell us a little bit about your family? And this is for both Sarah and Greta, whoever wants to answer. Tell a little bit about your family and your experience with Gillette.
I'll just let everyone watching know that Greta uses her eyes. I'll talk about this a little bit when we talk about what we rely on with Medicaid. You might hear her saying yes. She uses her eyes, and this is how we talk with her. So you might hear that computer-sounding voice, and that's Greta. But we're happy to talk about our family. We have an awesome family. Yes, we do. My husband, Leif, and I have been married for almost 18 years, and Greta is our oldest. You can see she's outgoing, and she's fun and full of life. We also have an awesome 11-year-old. We offered for him to come today, but he chose middle school instead. His name is Owen, and we also are so blessed with an extended family. My parents drove down from Duluth today to support Greta and I, and we have aunties and uncles and grandparents, and we call them our village, and sometimes we just call them Team Limbo. So that's a little bit about who's in our lives every day.
And you live in Duluth, is that right?
No, I grew up in Duluth.
Oh, you grew up in Duluth.
My
Your
parents
family
are
is
still
from Duluth.
there.
Right.
We live in Coon Rapids, and then we come to this location for a lot of our bigger appointments,
Yeah.
or we do therapies in Maple Grove.
So could you tell us a little bit about what your experience, what your experience is with Gillette, and how it works for you and your family, and Greta, how it works for you?
I'm glancing at my husband because we are talking about this, and we're both just so thankful. Clearly, we were not planning on this life. It was a surprise to us, and very early in Greta's life, we got connected with Gillette. She started doing therapies, and we met care providers, and we were welcomed into a world that our scariest was like their normal. And so we found a community and caretakers, and I wouldn't be surprised if Greta interrupts with a few names, but some of her favorite people are from Gillette. We've been given opportunities to get equipment like you see here with her power chair. We've done things, a brain stimulator to help with her involuntary movements. But what I really want to highlight is that with Gillette, providers have been very straightforward with what our reality is. but they present us with choices and with hope. And that is just what we need. We don't know what we're doing. I mean, we're
Yeah,
throwing
you've
into
never
this
done this
world.
before.
We've never done this before.
That's right.
And so to have people who have guide us through it eases a lot of stress and the burden of making those decisions.
So I can imagine that the stresses and the worries and kind of just doing everything for the first time when you are helping Greta is a stressor. But then, like, there's the money side of it.
There is that.
And I don't want to infringe on your privacy, but I'm wondering, I mean, I know how I would feel if I was trying to figure out how to cover the care of, of my loved ones. And this is where the importance of Medicaid comes in.
Absolutely. I am the feeler of the family, and my husband is the planner. And so right away, Leif got involved in what we need to sign up for and how we'll plan for the future and how we'll pay for things. And the biggest security net for us is MA. We have our jobs and we have primary insurance, but you guys would be surprised what primary insurance doesn't cover. Ours in particular doesn't deem Greta's talking device medically necessary. So they don't fund talking devices for Greta or children, people like her. And it blows my mind and it breaks my heart because this is my daughter. Like, what is she thinking? What is she feeling? How is she going to show that she's smart? We have to overcome a lot of judgment. Right. And recently we dealt with one of the first deaths in our family for a close family member, and I could see how upset Greta was, but to get her to her device where we could answer her questions and talk through it and make sure she was okay was critical. And life is full of moments like that, and Greta will always have her thoughts and her ideas, but it just terrifies me that they would be trapped inside her. We want her voice to be heard and everyone's voice to be heard, and I'm not sure people really are aware that me talking to my daughter and her saying what she knows at school, is directly connected to us depending on MA.
This, I think, is something that a lot of people don't realize, that there are folks who have private insurance through your employer who then rely on, but then MA, Medicaid, fills a really crucial gap. And I'm wondering, Barbara, could you just talk a little bit about that from the perspective of the hospital?
So at a general level, it kicks in like a secondary for those who are on Medicare. And so for services, devices, and for things that really give quality of life, meaning so that our patients can be living their best potential and being engaged in the community, that's where Medicaid does kick in. And I think people have an image of who's on Medicaid and what they are or what they're not. And I, through your help and those in our families, try to say these are, we're real people. And Medicaid does its best at covering. It can't cover everything, and then we fall to Gillette assistants and donors that help our families. So it's pretty complex. There's no fault here except for the fact that the reality is the system has challenges, and we need to figure it out. But Medicaid is the safety net for our children for their entire lifetime.
Dr. Neerman, would you just comment about what you see as some of the greatest challenges of providing excellent care and specialized care for kids and patients like you see here every day, especially when you're working with all different ways of paying for that care?
Yeah, that's an excellent question. So, the challenges are numerous. I think for the patients and families, first and foremost is access. So just being able to have Medicaid provide that access, provide that insurance coverage is critical. And as the Limbo family can really attest to, when you have complex conditions that requires multiple physicians, multiple providers, a very large multidisciplinary team. And what that means is it's equipment, it's frequent appointments, but it's also good coordination of care and it's continuity of care. And you really can't disrupt that if you want to have really important and good health outcomes. On the other side of that, if we look at just some of the other challenges, you could look at prior authorization, you could look at reimbursement rates, you look at just the way the healthcare system functions and being able to recruit specialty providers in order to provide the excellent and highest quality care for patients with disabilities. But first and foremost, Medicaid, and I think, Barbara, you said it best, it really is that safety net. It provides that bare minimum access and then actually just an ability for patients to be able to realize their potential, to be able to express themselves with us so we know how to treat them.
And to that point, so the reason we're talking about this today in particular, of course, is because there are proposals before Congress that are getting worked on right now that would have the potential of cutting billions and billions and hundreds of billions of dollars out of the Medicaid budget. And so just to sort of level set here, when you are getting reimbursement from Medicaid, Barbara, is Medicaid covering the cost of care?
No, Medicaid doesn't cover the cost of care, and of course, Medicaid is distributed at the state level. And so each state, then, it's different. So for patients that have to go between states, it doesn't work like Medicare, where it's unified. It's very differentiated. But no, it does not cover basic costs.
So if you're talking about reducing your expenditures for Medicaid, which is what is on the table in Washington, D.C. right now, there are a variety of ways that you could do that, right? You could reduce the reimbursement rate for how much you pay for what's getting covered. You could reduce who gets their insurance through Medicaid, or you could reduce the basket of benefits that would be paid for through Medicaid. So an example of that is if you were cutting Medicaid, one of the things that if you were reducing the benefits, you might reduce the ability for Medicaid to cover this incredible machine that allows Sarah and Greta and her family to talk together. And any of those reductions would have pretty huge impacts on the quality of care that you would be able to provide. Is that, I don't mean, is that, would you agree with that?
Absolutely, it does change the quality of care, and there is opportunity to improve the efficiency and the effectiveness of the Medicaid program, which we carry the solutions when we come to DC, as you know, and we're not a quiet team about that. There is a lot of opportunity to first fix some of the very obvious challenges and reduce administrative burden and these strenuous requirements to certify. That's also put on the family. Having to recertify on a regular basis that your child has a lifelong disability and medical condition is ridiculous, and that hits at the county level, the state level, the federal level. Right there, if we fix that, if we had updated technology where the counties, the state, and the government and their systems actually talked, that would be a savings. There's so much we could do first before actually impacting the wellness and the ability and the quality of life of our children.
I'm so glad to hear you say that.
Yes, I was going to turn to you, Sarah. That's great.
We joke about it a little bit, but it's really not funny. A couple times a year, we joke like, oh, have we cured Greta? Because they come out and usually we have to leave work early and just talk about Greta still has cerebral palsy. And at the beginning, I mean, I dreaded those. It was heartbreaking. Like, yeah, she hasn't gotten better. And, oh, she'll need more of this when she's older. And it's very redundant. And there's also a lot of paperwork that goes with it. It's a lot of stress. And I'm really glad that that comes to mind for decision makers well before some of the other services that we rely on. So thank you. Paper.
It's on paper, right?
On paper.
Well, this is a really important point for everyone to be making because we're not here today defending the status quo. We're saying that everything should stay exactly as it is. In fact, we want to improve it. We want to make it work better. We want to reduce the amount of time, Dr. Neerman, that you and the physicians that you work with and the other providers are spending filling out forms and paperwork, and the same for you, Sarah, and your family. There are things that we should be doing to improve medical assistance. And would you like to comment on this from your perspective as on the provider side?
Yeah.
Delicately prior authorization. And this is not an issue, I should say, this is not an issue exclusively with public insurance. It's a huge issue with private insurance as well.
Absolutely. Prior authorization, it's becoming more cumbersome. Physicians, APPs, we're spending more time doing paperwork, sitting at a desk than we are actually engaging with our patients and families. That gets back to the original, one of the points that I made before of, recruiting providers and being able to take care of patients in general, but also for patients with disabilities who have special needs. I was at a meeting last week, the Health and Human Services director at Blue Earth had a great comment. He said, we can't cut our way out of this problem. If we start with cuts and then try to figure things out on the back end, you have people trying to figure out problems in a panic mode. We can't think innovatively. We can't think of these, how we solve these things creatively when we're already behind the 8 ball. So I think to Barbara's point and to your point, Senator Smith, we have to start thinking creatively now and looking at ways that we can continue to refine and improve an already critically important program.
In my experience talking about this issue all over the state, it comes up again and again and again that these proposed cuts to Medicaid are really fundamentally about reducing the supply of health care, but not reducing the demand, the need for health care. And so when you make those kinds of decisions, you're reducing the amount of care that you're providing because you're not paying for it anymore. What happens, of course, is that that need finds another avenue to get met. If you don't have access, I don't know if you want to comment on this, Sarah, but if you had less health insurance coverage, what would you do? Where would you go? Where would you go? You're still going to have the same needs, right?
Yeah, when you said don't panic, I will say, as I realize all of these things, as I'm learning more about it, I'm panicking a little. I can't really let my mind go down what we would do if Greta couldn't get her cares medically met. But I think what's really important, too, is to think some of the things are less obvious that we depend on the insurance for. I talked about the talker, but I also want to point out that her paraprofessionals at school.
Very good. I'm so glad you raised that.
Yeah, you know. Greta loves school, and you're probably thinking of Miss Jill right now when you cheered. She relies on paraprofessionals to help her with her cares and her safety, and they are her access to the right to learn. If they aren't funded, I don't know if they could take away someone's right to education, but I don't think she'd be able to go to school, which then would have the domino effect in our family. And like I said, we overcome a lot of obstacles. When you see someone with a talker and a wheelchair, education is a big battle in our family for that right, and the paraprofessionals are a huge advocate to keep her learning and engaged. I know. That's a piece that makes me panic, that her day-to-day life would be different if they're just looking at cuts instead of solutions. Another area in our day-to-day life that is huge are personal care attendants, our PCAs. They're hard to find, but we have been very blessed with people who have become lifelong friends to us. And I'm comfortable going a little personal, I know, but I've always wanted to be a mom. It's just what I pictured my life being, and my dream came true. I have Greta, I have Owen, but a daily burden for me is how do I take care of Greta and make things that aren't normal seem normal and easy, and how do I give Owen my undivided love and attention and make his life seem as normal and easy. And that's what really, really weighs on me when I think about the future and motherhood and doing this right. And I need those people who help, because like the dad you were talking to, it's the same message. When I have someone in the house for those day-to-day things that do more of the caretaking and the medical things, I can take a breath and be their mom. And this is a really hard journey. It's really hard. And you have to keep your mind positive. You have to keep your body healthy. You have to keep your finances in order. And that little relief that we can have a normal afternoon because there's an extra set of hands really means the world to our quality of life. I just have to point that out because it's just so essential to our lives, and I think so many people in our position, and that comes from our insurance.
So I want to just say that I want us to focus on an optimistic moment because, I mean, this is scary, and I'm worried. But I will tell you that all over the country this week and last week and over the several weeks, people have been having conversations like this about the critical importance of Medicaid to making sure that people have the health care that they need to live the best, most productive lives that they are able to. And what is happening is all over this country, people are saying, like, hold the phone. Like, we don't want to see those kinds of cuts in health insurance for people. That is not who we are. That is not what we want. And that message is getting through to all of the members of Congress who are ultimately, at the end of the day, going to have to cast a vote either to do this or not. And so people have a lot of power in this moment to make their voices heard and to express how strongly they feel about this. And I mean, I am for sure going to vote against this. But what I can do is to use my voice and help to amplify all of your voices in order to make sure that that message is getting through to people who might not be sure how they're going to vote. And so that's why I'm so grateful to Sarah and Greta and all of the limbos that are here, and also to the folks from Gillette for hosting this and giving us a way of talking about how crucially important this is to Minnesota families across the board. And so just a huge thank you. And let me ask Sarah or Greta or Barbara or Micah if anybody has any other closing comments before we wrap this up.
How about if I send one and then you, Greta? How about that? So you think about what you want to go for. I would just continue to ask, as I do in person and through these events, to the members of Congress, both the House and the Senate, work in faith for your constituents and not out of fear of the administration. And so with that, I would say, Greta, how do you want us, you ready for us to use our voices? Yes. All right. Want to go back to D.C. with us? Yes. Yeah. Greta is quite the advocate. She spent many times with the Minnesota delegation as well as key members of committees, and is one of the best advocates for those served by Gillette and for those who serve at Gillette. So thank you for that.
I'm very proud of my daughter. I want to keep pushing her, and I really appreciate people who fight for all children. But we have to keep talking and coming up with a solution that goes beyond numbers and really looks at the people, and I feel like this format really brings a lot of hope to that. So thank you.
All right, great. Thank you so much, everyone, for being here. And now your job is to go out and spread the word. Thank you.